Genital warts are one of the most common sexually transmitted conditions worldwide, and many people who have them don't even know it. Today, we'll break down the facts clearly, scientifically, and without fear or stigma. What are genital warts? Genital warts are soft, skin-colored growths that appear on or around the genital and anal areas in both men and women. They are caused by certain types of the human papillomavirus, commonly known as HPV. HPV is extremely common. Medical evidence shows that most sexually active people will be exposed to HPV at some point in their lives, often without ever developing symptoms. Although there are over 100 types of HPV, genital warts are most commonly caused by HPV types 6 and 11. These strains are classified as low risk, meaning they do not cause cancer, but they can still lead to physical discomfort and emotional distress. How HPV is transmitted. HPV spreads through direct skin-to-skin sexual contact, including vaginal, anal, and oral sex. Importantly, transmission can occur even when there are no visible warts or symptoms. This is why HPV spreads so easily and why many infections occur unknowingly. The absence of symptoms does not mean the absence of infection. Signs and symptoms of genital warts. Genital warts vary widely in appearance. They may be small or large, flat or raised, smooth or rough, single or grouped in clusters. Common locations: men, penis, scrotum, groin, thighs, or around the anus. Women, vulva, vaginal walls, cervix, or around the anus. In most cases, genital warts are painless. However, some people may experience itching or irritation, bleeding from the affected area, or discomfort during sexual activity. If warts affect the urinary opening, they may cause changes in urination, such as difficulty starting or stopping urine flow or blood in the urine. How genital warts are diagnosed. Diagnosis is usually made through a clinical examination by a trained healthcare provider. In many cases, the appearance alone is enough to confirm the diagnosis. Sometimes, a special solution may be applied to make warts easier to see. In uncommon situations, a biopsy may be performed to exclude other skin conditions. Medical guidelines recommend seeing a healthcare provider if you notice unexplained growths, itching, bleeding, or if a sexual partner has been diagnosed with genital warts, even if you have no symptoms yourself. Treatment options. There is no cure that completely eliminates HPV, but genital warts themselves can be treated effectively. Treatment depends on the size, number, and location of the warts. Evidence-based treatment options include prescription topical medications that help the immune system clear the warts, cryotherapy, which freezes warts using liquid nitrogen, electrocautery, which removes warts using controlled heat, laser therapy, often used for extensive or difficult cases, and surgical removal, typically reserved for large or persistent warts. It's important to follow medical instructions carefully, especially with topical treatments, to avoid damaging healthy skin. Prevention, reducing the risk. Prevention focuses on two proven strategies. 1. Safer sexual practices. Consistent condom use significantly reduces HPV transmission, although it does not provide complete protection because HPV can affect uncovered skin. 2. HPV vaccination. The HPV vaccine is highly effective at preventing infection from the strains that cause most genital warts and several cancers, including cervical cancer. Medical organizations worldwide recommend vaccination for eligible individuals. Call to action. Genital warts are common, medically manageable, and preventable. Accurate information and early care make a real difference. If you found this explanation helpful, like the video, subscribe for evidence-based health content, and share it with someone who may benefit from reliable information.